Good evening, everyone. Welcome to the October 2022. Man, how can that be already? Compassion Chat. My name is Susan Marshall. I am the author of Mom's Gone Missing, When a Parent's Changing Life Upends Yours, and your host for these Compassion Chats. We meet the fourth Tuesday of every month at 6 p.m. Central right here on Zoom. Nobody's got to drive. We don't have weather to worry about. And the fact is, we have been doing this since March of 2021. We have recorded all of the sessions. So if you're interested in going back and listening to our other outstanding guests, the topics we've talked about, you can find them all in the archive at susanamarshall.com. Like we have in the past, we are recording this session this evening. So we'd ask those of you who are with us live to please mute yourself while the guest and I chat. We do open it up at the end for questions, comments, stories, just kind of conversation with everyone here. So I am especially pleased this evening to welcome Laura Volz. Laura and I have become friends over the years. She is a character player in the book, Mom's Gone Missing. So you might want to go read that and hear how she helped our family. She truly did. Laura is the family services advocate, which is exactly the right word for her, for Azura Assisted Living and Memory Care. She joins us this evening to talk about the whole notion of resistance to change, perhaps stubbornness on the part of our loved ones and even family members. Laura's helped hundreds of families over the course of her career. So Laura, thank you. We are absolutely delighted to have you join us this evening.
And I am also very delighted. Thank you for the invitation.
We love to start our chats, Laura, hearing a little bit personally about our guests. So if you wouldn't mind, give us a little bit of your background, and then most especially, what led you to do the work that you do?
So my background, I've been spending about, 15 years in senior living services. In my early years prior to senior living, I helped my mother-in-law through her end of life, which I really think shaped a lot of who I am today. And it really gave me a dotted line to find my purpose in my advocacy. And I didn't find it until about 15 years ago, but I'm glad I did. And I love helping families navigate senior living services, all parts of it. You know, anything from education on dementia, care, financial piece, even some legal things when we talk about POA paperwork and what we need to do to be prepared for our parents or our loved one, husband, wife, sister, friend. So that's kind of how I've come to this terms in my life, and I love what I do and very passionate about it.
And you're very good at it. I can absolutely attest to that. One of the things that you were really helpful for me and my family, Laura, was understanding the variety of places, right? Whether it's full nursing care, whether it's assisted living, whether it's memory care. You were very helpful in helping me understand the questions that I needed to ask the providers. You were also helpful in helping me kind of understand what to expect from mom primarily, but also somewhat helping deal with siblings who have their own stories, their own ideas, their own perhaps decisions prior to before they were actually made for mom. So talk to us about, how do you help orient families to the need for change?
Well, and I think part of it is really just a discussion to really understand who the individual is that we're talking about. So let's say it's mom. I really go through somewhat of a clinical assessment to understand if we're talking about someone, let's say with dementia. I want to draw a picture in my mind who that individual is. Because when we make decisions for other people, it is for that person, and we need to honor them and understand where they're at in their journey. So, because that really changes the questions and the answers. So I go through that kind of needs assessment, understanding where they are cognitively, where the challenges are, what's happening. And because my experience working with people with dementia, it helps me formulate who that person is. What do they value? You know, how can we help mom have quality of life and purpose every day? And that's really what we're trying to seek, because health is quality of life. So I guess I start from that process and then work through understanding the family dynamics. Understanding that's such a big one. Who are the decision makers is important. And otherwise I could get lost in the process if I don't understand who is actually ultimately responsible. So understanding the family dynamics, the challenges with it, what mom wishes for her own children. That one's a big one too. And
So
just drawing that full picture.
yeah, so let's stay with that, what mom wants.
Yeah.
Mom doesn't want to change anything. Mom is perfectly fine. We should all just get on with our lives. She's good. How do we move that to a different place?
So I think it's through, it sounds funny, but relationship building with your parent. And there's a time when there's a role reversal that occurs between parent and child. And this is a piece that I coach quite a bit on the children. They have to start doing a role reversal, and they have to start working with mom so mom can accept the role reversal and be comfortable with it and move forward, because otherwise you'll be just stagnant. You're not going to walk into mom's house one day and say, Mom, you're moving to memory care. It's just not going to happen. Now, depending upon where mom is in her journey with memory care, that does answer some of this question and how you're going to move it forward.
So talk about that role reversal. What does that mean? How does it start? How do we begin the process of doing that as kids?
Yeah, yeah. I think, part of it, I think the children need to understand that my 80-year-old mom, her thoughts and beliefs are from 1950. I'll give you an example. My mom was about 79 actually. And she came to me one day and she said, Laura, all these medications, they have so many medications for everything. All you see is these commercials with medications. And I sat on that, went home, slept on it. I woke up the next morning and realizing mom does not understand current medical needs, current culture of care. She doesn't understand that. In fact, she still calls my assisted living memory care community a nursing home. She refuses to get past 1950. So that's helpful. If I can understand where my mom's mind is at and stop thinking about her being mom, but trying to understand where her mind is at and how she thinks and how she views things. Now, of course, you're talking to someone who has dementia, so you have to put that into, perspective also. And sitting down really with mom and having multiple conversations that are loving, that are strong, that are supporting, and put yourself outside of that daughter role. Start to change that structure.
It's interesting hearing from someone like you who has seen it and worked with it as extensively as you have. I don't know a family member today, after 2 years of the book being out, and likewise speaking to a lot of people, that's not something that comes naturally.
No.
And B, sometimes I just flat don't want to do that.
Yes, correct.
Stubborn. And the stubbornness, from what I've seen, often comes from fear, from
Yes.
uncertainty about if this isn't the way it is anymore, how is it? And then what is my role in that? Talk to us a little bit about that whole sort of mental, emotional shift that needs to happen.
Yeah. And again, there's a mental and emotional shift for both partners, the daughter and the mother. And it's really upon the daughter's responsibility, and she needs to honor that and embrace that shift. She cannot rely on mom to provide that shift. It won't happen. Mom is 80 years old. She has dementia. It's not going to happen. She may have been the monarch of the family, and whatever mom said, it went. And we don't want to tear mom down and make her feel like a child. And that's where that respectful conversation needs to start coming forward. So my dad passed 3 years ago, and my mom now is 83 years old, and she's living alone in a condo. We have had numerous conversations. What are your wishes, Mom? And I did this early on. Now, my mom does not have dementia, but I still had those conversations early on. About a year after Dad passed, I started having these conversations with her. And we've talked about it. And my mom is as strong as anyone else at 83 years old. And, I don't want to go to one of those homes. I don't want to do this. I don't want to do that. And so then I started talking about the house and started talking about the risks. Okay, Mom, let's talk about, what does that look like? What things could create some serious problems for you within your environment? One of the things is she has an open stairwell that's at her back door that comes into the garage. I hate it even for myself. I turn the light on every time I pass that stairwell. She brings in groceries at that stairwell. We've had multiple conversations about that stairwell. We talk about feeding the birds in the winter. We talk about getting mail in the winter. And we started having these conversations. And it took probably a year and a half. And her and I talked about, she said, her son-in-law could build a gate on that stairwell. I said, well, if you did that, it'd have to be a gate that if you fall against it, it's not going to move. She thought about it. She thought about it for probably a good 6 months, and I reapproached it. And she said, Laura, when I have to build a gate, I'm moving. And so it was moving her forward to come to terms with her own future loss of ability, which is so very hard for anyone to accept. So you have to do it so very gingerly with an individual, because you can't just barge in and just say, this is what it is. You have to help them come to terms.
I really respect that. And I think that's counter to our tendency, because initially we say, it's fine. They're just getting older. It's not a big deal. Fine, 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 fine. Until we get to the point where we actually see evidence that it's not fine.
Mm-hmm.
And then the rush and the panic to do something, anything, which is exactly the opposite of what you're describing here. Talk about something, let it be. Talk about something, let it be. And help really the loved one come to the point, their own decision that, what, this is really not going to be the long-term answer for me.
Yeah. Now, that's if, of course, you have time and you have somebody who can decision make. Now, when someone has dementia, one of the first things that go is decision making. So that changes the picture quite a bit, kind of like your mom. It was just too hard for her to make that decision. So if we're talking about more in that crisis-driven role versus being proactive, everyone should have these conversations with their parents. Now, my mother could have a stroke today and be in memory care tomorrow. Reality is the disease travels that way. So even if you think, oh, mom is just fine, she's 83 years old. No, she isn't fine. She's 83 years old. And I think that's the other part that I think children need to understand is everything's just fine. They don't want to touch it. They need to touch it. And that's part of that role reversal.
Well, and we're not trained, right? Any of us
No.
are trained to do this. I want to shift the focus a little bit to spouses.
Yep.
My experience was as the child, I've got 5 siblings. That was our experience. Mom's experience before her own decline was with Dad. I have talked with a number of married couples married for life, right? For
Yeah.
better or worse. This is just a challenging time now. I got this. I can do this. When do couples need to help each other, and how? Forget about when. How do couples help each other recognize that, you know what, it's time to really be thinking about something different here? Talk to us a little bit about that scenario.
So you're talking about a mom and dad living in their home. One of the two needs a little bit more assistance than the other. How do we talk to them as a couple to talk about that? Is that what you're talking about?
No, I take the kids out of it entirely. Now I'm married to a guy, or he looking at me, and we're both 85, let's
Yeah.
say, and we're
Yeah.
still at home, and we're still kind of helping, propping each other up. We're fine, we're fine, we're fine.
Yeah.
When does the couple come to the conclusion, and how do you help them? Forget the kids now. How do
Yeah.
you help two individuals who are married, committed to each other, supporting each other through a challenging time, recognize that it's time to do something different?
Yeah. Yeah. I actually did have a scenario very similar to that. The lovely lady lived with us for 4 years. The husband came to me because his wife had dementia, and he wanted to be proactive. At least that's what was in his mind, being proactive. Okay. Remember that word. And he wanted to, at least put her on the wait list. He wanted to take those baby steps, and thinking he was being proactive to do this. And I got to know him really well in our visit, found out that he had health issues that he was also challenged with. And so I had a very real conversation with him to talk about how she needs you. Because as we grow older as couples, we grow older as one. We become reliant on one another to fill in the spots that need to be filled in. And in order for a couple to be successful in their older ages and to continue to be a couple, they need to seek help sometimes. And what I said to him, he said, "Yep, I'll go on the wait list." And I said, "Okay." I said, "But I want you to think about something overnight. I want you to think about what would happen to her if something happened to you." 66% of caregivers who care for people with memory loss pass before the person with memory loss. How would this shake out? What would this look like? And it's not sending fear, it's bringing reality forward to be realistic, because most couples say, I can do another day. I can do another day. I can do another day. But what happens if another day comes and he gets sick?
And you know what, Laura, that really is the question. And I have talked with a number of elderly couples exactly at that point. It's not time yet. And I have often said, please don't wait too long.
Mhm.
But when and how do you continue that discussion? You've had many, many, many of these conversations. What have
Mhm.
you seen that tends to get people to say, you know what, as much as I really don't want to acknowledge this, it's time?
Yeah. Well, very unfortunately, most people come to me way too late in the game. That's the downside. Um, Occasionally I can get to people in the earlier stages and start providing that education and those conversations. Once they wait too late, it's a total different kind of situation. They're usually in a crisis position. I have a gentleman right now whose wife is not extremely advanced, but everybody has a different breaking point. And he kind of hit his breaking point. And I had been having conversation with him, and he finally said to me yesterday, "I can't do this anymore." And what does that mean to one person is different to another. And that's why that conversation with them, to understand where their challenges are. What is his wife like? How much assistance does she need? So I can draw a picture of what they look like in that household and their day-to-day functions. And I can generally figure out where the challenges are, but I want them to say, this is my challenge. And to verbalize that challenge, those challenges, and accept them. And I think that helps.
Yeah, isn't that the point where people say, oh, I just said that out loud?
Right.
Must be real. So you mentioned earlier about legal affairs, POA documentation, that kind of thing, financial stuff. Health records, of course, are big. What's your advice to people who are, if not already, trying to make a decision about change with someone who is cognitively impaired? Let's just say it that way.
Yeah.
He doesn't have a diagnosis yet. What order of priority do we need to be thinking about, planning ahead for? When do I need to talk to an attorney? If there's no will or estate, how do I even find out whether there is one?
Well, it depends on who we're talking to first. And I think one of the first things that I think are most important is to find out who is the healthcare power of attorney and who's the financial power of attorney. Is there one in place? This is a big piece. Right now, I have a gentleman like that who has a healthcare power of attorney, but he doesn't have financial. And he is deemed incompetent. So now it's going to be wrapped up in the courts going for guardianship for the estate because there's nobody able to make payments for care. So a healthcare and a financial power of attorney, I honestly, this sounds kind of strange, but is more important to me in my mind than the diagnosis of the dementia.
So given that,
okay,
when should people begin asking about that? Like birth?
Yeah, like birth. I have mine in place. I did mine many, many years ago. I think that young people should do these things as soon as they can. You can update them at any time and the new one overrides the old one. I would always recommend having, Jane Doe is my healthcare POA. If she's unable to do so, then Mark Doe will be the second POA. I would always recommend two, one as a backup, and I would do it for both financial and healthcare.
Now, you don't necessarily need an attorney to have those documents together, right?
No. See, and that's a good question because, sometimes financially just bringing attorneys in it isn't very helpful because they can be expensive. Honestly, you can go to the state of Wisconsin and you can download those documents and they have standard documents. I see them on a regular basis. One of the things on the standard documents is there's permissions to provide care in a skilled nursing facility or a CBRF licensed community, and always say yes, because the memory care is licensed as a community-based residential facility.
Okay, so that's the CBRF. Okay.
Yeah, that's an important check because if it's not checked, I cannot move somebody in my home. And then a new healthcare POA would have to be written, which is not a big deal. That can be done.
How often, I know that I've from time to time had my healthcare primary care physician remind me about POA. I think anytime you go into surgery, they ask you that question, just to make sure there's somebody that you've identified in the event that you would become disabled, right?
Yeah.
Who, you mentioned the gentleman you're working with declared incompetent. Who did that?
So what had happened is he lived at home. He was doing fine. He had a fall, went to a hospital, and the hospital had a healthcare power of attorney copy of one. Apparently there must have been someone somewhere, maybe he had surgery at one point, and then it was at the hospital. They declared him incompetent. Now, the problem is he has not identified anyone to access his funding. So now there's no one who can go to a bank and say, gee, I need to write a check for care. There is nobody. So then they will have to go for guardianship.
Whoever they is, right? Family or?
Yeah, the family will have to go for guardianship, and wherever he is at, the social worker will assist him to do that.
So I want to bring it back to the kind of the topic of stubbornness.
Yeah.
You see a lot of it, I'm sure.
Yeah.
Is it fear? Is it, I don't want to be bothered with this? Is it, I don't know how to do this, I'm busy with my life? Where does the, if you see any patterns?
Yeah, I do. I do. And I think with husband and wife, I think fear is really the basis to it all. It's fear of change. So here you've got a couple that's been married, 65 years. You know, he always did this task, she always did that task. They're now one. And now we're looking to separate them. It's actually not much different if you think about it, like death. So when you lose your spouse, you as an individual living at home have to learn how to remake yourself. So when you have your loved one and you living at home and you have to place your husband, now you're going to be alone in that house. You're going to have to learn to remake yourself. I went through this journey with my mother the last 3 years. It took her a year to get to that point.
We lost your audio. Did you accidentally bump something? You weren't touching anything. Oh, there
Oh,
you
there
are.
you go.
Okay.
Very good. I don't know what that was.
So you were talking about couples and having to, one, if you put a spouse, I hate even to say it that way, you help a spouse by placing them in a care facility, you have to try to relearn to live alone.
Yeah,
You were
that's
talking.
that's a frightening thought for, let's say, a woman who's been married for 65 years. She's lost her identity with him, and he's lost his identity with her. They are one as a couple. And so, I had mentioned my father passed, and I worked with my mother. We had Tuesday lunches we do still actually occasionally, not lunch, dinner, but every Tuesday for a solid year. And I would sit with her and talk through and hash through, and she learned to love life again and found her way and who she is now as an independent individual. And I do believe that is the very same as if you're placing your loved one in a home.
Well, let's talk about that, Laura, because I know that there are people, many couples that I've talked to, who part of the stubbornness initially is because they don't want that change. To your point, they don't have an identity separate from couple.
Yep.
They don't want to have to even try to think about what that means. How do you help couples that you have one or the other spouse at Azura? How do you help the other spouse come to terms with recreating an identity?
Well, and I generally don't work with people after they move in. So I'm usually working with people on the move in, and I might spend a year, it might be 6 months, it might be 2 years. I recently have a gentleman I've been working with for 4 years. So there are long-term relationships. Stubbornness occurs out of fear, not a proper education to understand. It's an emotional piece that we just have to peel back the onion and find out what is the root cause to that fear. Is it because we don't know what it would look like once they did move? How am I gonna be the husband again? How am I gonna be the wife again? And part of it, they're caught up in care for their loved one. They're caught up in it so immensely that they can't even think at this point because they're so stressed out. They often obviously get to their breaking point, but I'd rather see people not. I'd rather have people have a more planned approach. So
And
just organic conversations, Susan, and just trying to find out why that fear is there. What does it look like?
I think that's a phrase that you've used a number of times. And for someone who has not been trained, which most of us have not been, to have even opening discussions, what does that look like? Seems to be a non-threatening way to say, let's talk about if you had greater care, or if you felt more comfortable, what would you like around you, right? What kinds of things? Because I don't think any of us even know how to start the conversation. Therefore, we don't.
Well, again, it depends. Now, if a child is talking to a parent, that's a different approach. If I'm talking to a parent, it's a different approach. I mean, I've actually had um, husbands and wives, their barrier is the financial piece. Believe it or not, even though they love their spouse and all that, they would do it tomorrow if they felt secured. They are shattered at the fact that they spent a lifetime saving this money, building this life, and poof, it's going to be gone because there's going to be, this is in their mind, because all the money is going to be drained. I worked for 40 years, and now it's all going to be gone. So sometimes it's not necessarily about the care component. It can be also a financial component.
So your best advice, whether it's a child, whether it's a spouse, what is from a not only opening a conversation, but let's talk a little bit about demeanor, right? Because when we approach a conversation we're not comfortable with, have no experience or training to do, we tend to be a little tense, right?
Yep.
Which transmits,
Yes.
kind of gets everybody elevated emotionally. Give us some tips on how to manage that.
Well, I think I go into difficult conversations on a regular basis. And, when I first started out, having conversations with someone about care, intimate details about care, intimate details between husband and wife, and what happens behind closed doors and how difficult that is. Details about finances and all sorts of things. But part of it is you have to train yourself to be able to have those difficult conversations. So what I recommend is you start that conversation, let's say with mom, and you have that conversation, push yourself a little past comfort. Now, always remember honoring, respect, being gentle, be kind, be loving. You can't put those aside. Those have to be number one. But when you're having the conversation, push it a little further past your comfort level. Each time, push it a little further. And what you will learn, you will have emotional growth by doing that. And then as you have these difficult conversations, you're going to be able to handle more and more and more. And that's a training that someone has to learn, and it's not going to happen overnight. But that is going to be key to getting to the root cause of why mom is so stubborn and why she doesn't want to make this move. Is it a financial thing? Is she frightened of her own future? What is it? Is she too far away and she's not a good driver and she won't be able to see him? And it could be all the above. And then we have to take each one of those things and break them down and tackle them, talk them out through, find creative strategies to get around them, because everybody has a barrier. But now, mom, let's talk about this. You say that it's going to take you 25 minutes to go see dad and you want to see him every day, right? And so what is that barrier? And you might find out that mom's not very confident with her driving. And that might be the biggest barrier to get him placed, as simple as that might be. And then find creative strategies to bridge that gap.
And I think that's where the conversation with someone like you can be so very helpful, because, I may be, okay, I'm going to have a conversation I'm not comfortable with. I can do that. I can breathe, whatever. But I don't know what the options are.
Yeah.
So do you help families, Laura, in talking through these kinds of discussions prior to making suggestions or saying, you know what, the time has come? Talk a little bit about, your advocacy role with families. When do you start? How do you go about that?
Well, and like I said before, this advocacy is a professional and a personal advocacy. I just happen to be lucky to work for a great company, and I would have to work for a great company because I'm so passionate about it. I have to be able to support with an organization that can deliver my expectations. So let's just say that. But anybody who wants to call and talk to me, whether they want to move to Azure or not, I will be there and I'll help them. I tell people I'll take my calls 7 days a week, even on the weekends, because sometimes crises happen on the weekends. I mean, someone ends up with dad in the hospital on a Saturday night and they need to talk to somebody. I want to be here for them. So I'm happy to have conversation to try to draw the full picture of what's going on in the family. What are those health things? What are the financial things? What are, family dynamic things that are creating barriers of people to not move forward, and help them get past that barrier to make a good decision to get their loved one into place before a crisis happens.
So you helped me and the family very, very much. Mom was not here. I was fortunate that the Azura and Oconomowoc was brand new. We met, the community open house. How would you advise someone who is not living in the same location as mom and dad to find someone like you to talk to?
That's a big challenge. I wish some days I was on top of a mountain somewhere where I could really reach my voice. That is a challenge, because I guess I personally probably would try calling different memory care homes, different assisted living, and really use your gut feeling. Share with them full honesty of what's going on. Paint the picture, have an honest conversation with somebody. If you feel you can't have those real raw conversations about what's really going on and what's really bothering you and what those barriers are on, then move on to another person. Because you have to find someone genuine who is really an advocate. And once you find that person who's an advocate, utilize their skills and education to be able to move yourself forward and get your loved one to care. I don't think there's anything wrong with that, because people like me don't mind helping, even if I can't. Even if our location isn't the right location, even whatever it might be. I don't mind, because at the end of the day, I want people to find care. I want them to not go into crisis. I want them to have families that can come together with decisions. I've actually done full family conferences on calls and just talk about it, because sometimes everybody has to hear the same thing. That's another problem, a big problem. And when you're translating, Susan, to your brother, what I have said to you, it's different than if he hears it directly from me.
No question about that. And I think that's a really, really important suggestion, Laura, is when there are family members, 1, 2, 20, it doesn't matter.
Yep.
For everyone to hear the same factual information in whatever context the professional can help place it. Everybody to at least be aware of what a professional opinion or assessment, probably a better word, is, and how then we collectively can talk about that which has been presented to us, which is different from that which we presume separately, and then put into this mishmash that it's all conjecture at that point.
Yeah. And honestly, and I will tell you and everyone, in which all families have challenges. All of them do. I think if the family doesn't, I find it hard to believe. All families have challenges. Everybody has a different belief or thought or agenda about what should happen with mom. And if we can get to good people who will be honest and have real conversations with you, I think that could help a great deal.
Agreed. Absolutely agreed. I would like to open the floor now for anybody who has a question for Laura that I had not thought about, a comment, a story, an experience. Now's your chance before we close up and put Laura in our archive. Anybody on the call who would like to talk with Laura, please go ahead.
Hi, I just wanted to say that I really appreciate you talking about that POA. Mine is a little bit different. My mother is living with me here at home, don't have a spouse to deal with, or, dad. And I'm just starting that. I have a POA that I did before, but I just actually, I just contacted somebody because I wanted to make sure I was like up to date. And the thing that I was most worried about is if anything happened to me, who would step in, because I'm the only child, so there's no
Oh,
siblings.
yeah.
So, and I did get advised, I'm thinking about putting my husband on there. And then now that I'm thinking about it, I should probably do one for myself and have my husband and my
Yeah.
son on there too. You know what I mean? Because I mean, I'm already thinking ahead because I keep seeing, you never know what's going to happen, right? And so the POA is something I am working on now. My mom is finally, there's no way, she hasn't been labeled with any dementia yet. I can see those signs of forgetfulness and things like that. I'm working with her doctor. But since COVID, I live 4 hours away from where her home is. And so when COVID happened, we brought her up here because there's no way she could have done it by herself. And
Right.
so she, of course, was very resistant about not going back to her condo, although there's nobody close by
Mm-hmm.
that could possibly be there to help her out. So she's starting to slowly now kind of get used to it. I mean, she's been with me for 2 years now, like not every day. So she's actually kind of now talking about, okay, maybe we'll sell this because we've had a lot of repairs down there. And so, financially, it's just ridiculous, repairs of a roof, repairs of this. And I do have someone that comes and checks, but it's just not the same as me being close by. I guess the other question I have is, besides a POA, is there anything, I'm trying to get I have found a lady who was a caregiver who I'm calling in maybe every 2 weeks to come and take her to the senior center so that she can get out and do something fun like play dominoes or things like that. Of course, it's expensive, so I'm trying to be smart about it. But I would like to see her more. I'm trying to get her quality of life up.
Yes. Yes. And I think that's really important. The engagement is really important to keep our mind sharp. It's actually known fact, the higher the education, believe it or not, the less amount of dementia individual has. So that engagement, that learning piece is really important. One thing I would say to you just to think about, and we didn't actually, there's so much we didn't cover, but keeping mom at home is a great plan. But when you start incorporating costs for other things that are necessary, like maybe, transportation or home care, things like that, keep an eye on her monies. Because if you pay down her monies and to a point where she doesn't have 2 years private pay, you'll have a difficulty placing her in memory care someday. So, if she doesn't have that now, then bringing in home care probably is not a good choice.
Mm-hmm.
Now, I know that most communities have a 2-year private pay. If you move her in, they will take her to Medicaid. So scheduling the time to move her sometimes is a financial piece. It's not always a clinical piece, because if she gets down to $50,000, you will have very big difficulty in placing her, and you're not going to place her in the places you're going to want her to go in.
Correct. I know. That's why I did contact an estate attorney, and I am talking with her about that, because that was one of the questions that I had. And we're in Texas, so I'm trying to figure out everything here legally. Because I've heard different things. I've heard people don't have her have so much money in her account, but then the other people are saying don't transfer that because you'll have problems. You know what I mean? So that's what I'm trying to deal with, because I hear two different sides, and I'm not sure what to do. So this attorney is kind of helping me, and so I just started that process. So
the other thing I'd want to mention about engaging in an attorney to help you out. There are a lot of great attorneys. Trust me, there are. But if you go to an attorney and say, my mom has, let's say, $500,000. Mom always wanted to, set aside, $200,000 to each of the kids, or whatever it might be. And you want to find a way to secure that money for the children. And it's If you ask an attorney to legally divest funds for you, they will. Great. Mom's going to have that, 200,000 for each of the children, and she's going to have left whatever money she has left. That's okay. But if you legally divest the funds to children or whatever she decides to place that money to, and what is left is not enough to support her care, then you're going to have a big problem.
Yeah,
And I do see that. Sometimes I've seen even like mom and dad think that, because this is what they did years ago. They did things like give houses to people and stuff. And I want the kids to have the house. Well, mom has $20,000 in the bank and she has a house to sell. And now the house is in the children's name. There's no money to care for her. So that's another thing. So I guess I'm a little cautious when talking to attorneys.
Mhm.
I've met some wonderful ones, but I've met others that, you tell them to divest it, they're going to do it because they're going to do what you want them to do.
Right. I don't think that this one is doing that, which I think is really good, because that's one thing she's like not advising.
Well, Laura, I want to thank you so much. That you're right. There are so many things we did not talk about that we could have, but we certainly appreciate your insight, your advice. Thank you from the bottom of my heart and many other families that you've talked with for the wonderful advice and counsel you give. Thank you for your patience.
Yeah, no, well, thank you for your patience.
The greatest gift. I want to remind everyone that this chat will be recorded, is being recorded. You will find it at susanamarshall.com. We try to get it up within about 10 days to 2 weeks. Laura, again, I thank you so much for being with us this evening. If you would like me to include your personal phone number, I'm not going to ask you to do that now, but you can let me know. I can certainly include that as part of the wrap for our chat this evening.
Okay. Yeah, I don't mind, Susan. I don't mind sharing my personal phone number to anyone who needs assistance. That's fine.
Okay, I will get it from you and we will include it on our recorded, archived version of this chat. I want to thank everyone again for being with us this evening. We have one more chat left. That's next month, the 4th Tuesday, and I don't remember exactly what that date is, but we will have an individual here to help us talk about planning for Medicare and those kinds of decisions. What do you look at? How do you think about all that? So that is our chat. Again, Laura, thank you so much for joining us this evening. Thank you all. Have a wonderful evening, and I hope to see you again next month.
Bye-bye.